No worries. Our second speaker today is Dr. Milena Georgieva. She is an associate professor of molecular biology at the Bulgarian Academy of Science and holds a master's degree in cell biology and embryology. She is a scientific consultant at the International Inago Institute Academy that aims to support scientists from all around the world with advice on academic development. Some of her professional interests are in the areas of molecular biology and genetics, epigenetics, and modern biomedicine. Dr. Georgieva, you're welcome to start.
Hello, everyone. It's a pleasure to be here with you. And I think that my presentation, which is focused on aging, let me share my presentation now, is on longevity. And I think it's a nice leap from the presentation of Dr. Antonova, because she very well introduced the advantages of genetic technologies, and I'm going to show you how this helps the aging research. So the topic of my presentation is Spotlight on Personalized Longevity, which is a real hot topic nowadays. And if we look back to our history as human beings, we can see that the longest quest in human history is the search for the fountain of youth. And this idea has been formulated back 400 years before Christ by the Greek historian Herodotus. And if you go back to the Greek medical specialists these days, like Hippocrates, we can see that these people over there, ancient people, only by empirical science have been able to show that 1,800 of health and disease pathologies are considered as a result of the age of the organism and the imbalance in the full-body fluids, like blood, phlegm, yellow, and black bile. Later on, 300 years later, the Roman philosopher Marcus Cicero formulated his idea or his hypothesis that old age itself is a disease. Just imagine how smart has been these people at this time. And if you follow the graph, you can see that, yes, we were able to extend the lifespan very importantly, but we did not succeed, no matter that we changed the environment, no matter the medical technologies, we did not change the decay start point in the aging body. And if you follow the graphs, you can see that the decay in the body that is associated with the aging process starts at the age of 35, no matter the prolonged lifespan. So it means that something is missing in the big picture of aging, and here should unite and work in very good complemental symbiosis, all the efforts of the scientists in order to see what's the missing point to don't be able to change this decay start point, no matter of the lifespan. Well, if we look at this table with all these long-lived and living organisms, we can see that we did not succeed in making us living until the age of 200 years. So it's around 122, 117, and so on and so on. And all these people, as a matter of fact, that already have died, no matter that they have been centenarians, they died by age-associated diseases, which means that, okay, the prolonged lifespan is something good, but what's important is the health span, or how these people live these years later on in their individual life as happy and healthy individuals. Well, yes, the maximum lifespan appears to be unchanged yet. So you agree with me that we spend billions of money, billions of euro, dollars, and whatever to treat the downstream events of aging. Only in USA this year they will spend more than $500 billion on pensions and $300 billion on treating neurodegenerative diseases, and almost the same amount of money to treat cancer. So we spend a lot of money treating age-associated, age-dependent diseases. And we know that only 1 year, calculations has shown that only 1 year of extra life brings huge financial benefits to the whole world population. and yet the fountain of youth is undiscovered, but today is pursued more than ever, because anti-aging research has been a modern field of recent biology and molecular biology and genetics as well. Anti-aging turned into a big business, and there are a number of many startups and companies that pursue one and the same goal. And this is to stop, eliminate, or simply slow down the process of aging in our bodies. And they include the recently founded auto slabs. You all know the news that was spread all around the world, because these people over there will try to reprogram the human body in order to stop aging and age-associated diseases. And it is very much founded in what we have done during the genetic revolution that has been described by Dr. Olga Antonova. And all down they go to calico labs that has been settled 10 years ago, and yet they did not found the fountain of youth. So we need a multidisciplinary approach, or transdisciplinary approach to tackle this. What is very, very important for us scientists and medical specialists is that in June 2018, the World Health Organization released the 11th edition of its International Classification of Diseases. And guess what? The old age appeared as a disease code, which was a very good point in our research. And this boosted a lot of money in this kind of research. And in 2020, the United Nations General Assembly proclaimed the beginning of the so-called decade of healthy aging. So a decade of healthy health span and prolonged lifespan as well. So I believe, as part of this research and following all the trends, that we are entering a revolution and a pivotal period, just the same as we were entering the genomic revolution at the beginning of this millennium. And yes, we have 7 signs, even more, of longevity revolution, and they involve all the efforts that are put toward the personalized medicine and its definition and the way it works on the patients. Also involving the global tech giants that entered into life sciences and made life sciences very important and very, very well recognized subjects for research. Also classifying aging as a disease 3 years ago, and all the interventions that were aimed at augmenting the humans and extending the health span. And yes, the economics of aging research is growing rapidly up. So what is aging from the biological point of view? Okay, we discussed aging. We know that we grow old and this is inevitable as a matter of fact, but what it is indeed, what's happening, what's going on? It's not only the white hairs, it's not only the physical disabilities. There are many things that should be spotlighted as biological molecular mechanisms that happen in our bodies. Yes, from the biological point of view, the aging is something inevitable. It's a time-dependent decline in all functions in our body. It also involves a series of processes that incurs direct damage to our body, and not only to our body, also errors in the biomolecules are accumulated that we cannot repair, and it's also some of the part of the aging theories. And also it is a very complex process that goes on all levels that you can imagine, starting from the molecular cellular up there to the aging organism. And yes, the graph down shows that, yeah, we can prolong lifespan, but the most important aim for us scientists and medical specialists is to prolong the health span, this time when we live our old years happy, healthy. So this is the decade of healthy or happy aging. If you go to the modern theories of aging, because if you want to tackle a disease like the aging, we should know all the theories for that try to explain why this process happens in our body. And we go back to the programmed aging theories, which are very famous. Okay, this is a programmed longevity. We have different theories for aging of our systems. We have the damage and error theories, a lot of wear and tear theory, the free radicals theory, and so on and so on. But what is very, very much famous today and that unites all the others theories is the information theory of aging, which shows that aging is a result of the deterioration of changing the differentiated cell's epigenome. So this is changing the information, all the signals that govern the cell to use its genetic information in a particular level. So this happens on this level and unites all the other theories. So this theory, the information theory, looks at the aging body as a whole ecosystem that starts from the most important biomolecules in the human body, DNA, RNA, and proteins, and go up there to the aging organisms, going through the cells, organs, tissues, and so on, to get this not so good looking picture of an old man in a wheelchair. So how to make a longer lifespan, a longer health span? So this is one of the very important ideas that we try to tackle, or try to make with our efforts, is just to extend this position of decay in the human body, this position of accumulating this information errors in the way the genetic code is read in our cells, in order to have a prolonged health span, which can coincide even with our lifespan. How can we make this personalized longevity? This is a really very hot topic at the moment, and it's something that is going at a fast speed. And I always say that the moment I blink my eyes, something very big happens in this field, fortunately and unfortunately, because we cannot catch up. So the personalized approach that analyzes our biological data to optimize our health, improve our lifestyle, and extend our health span is called personalized longevity. And it is personalized because it is focused on all the levels of a certain human body as a whole ecosystem. How can we do this? Of course, by identifying the key drivers of aging. So we should know very well the process of aging. And believe me, this is very well known, up to date, from a scientific fundamental point of view, to analyze the biological age rates, to have the so-called clocks for analyzing these rates at which we biologically age, because there is a difference between the biological and the chronological age, and our idea is to make them coincide, to have a very good biological age at a very late chronological one. So this is the main aim for us. And also to close monitor all the hallmarks of aging, and to get this health and longevity active advising, as we already heard in the first presentation. So this is real, this is happening, and there is a very big field for development of this market, of this science, of this technology as well. So we have an urgent need for accurate aging biomarkers, because to tackle something, we need to know it very well. You cannot control something that you don't know well. So a lot of investments of efforts and money are in identifying the accurate aging biomarkers at the genetic, epigenetic, and metabolic level. Also, a lot of precise clocks for biological age are being developed and are developing at this point, and they unite different technology in a multidisciplinary approach, like artificial intelligence, data analytics of our body, biological biomarkers, and so on and so on. And we have in 2013 the biological DNA methylation clock of Dr. Horvath, which has been upgraded today with this artificial intelligence to the deep MNH DNA methylation aging clock, which is based on a neural network, and it's really very precisely measures the biological age of a person with an error of 2.7 years, which is anything, because we refer on biochemical parameters. And also we need accelerated clinical trials with geroprotectors, the so-called senolytics, with a very big hot topic today. There are so many on the list, you cannot believe in the databases. There's so many senolytics that are used in clinical trials in order to tackle all the genetic, epigenetic, and metabolic aging hallmarks that happen in an aging body. So we have a lot of work to do, luckily, because we have something very meaningful to do. So which are the most common cellular hallmarks of aging? This is an amazing review by Peresutin and his colleagues, published in 2013, that is cited, I cannot imagine how many times, because it's a very good illustration of what's going on in the aging organism at all the levels of its cells, molecules, and organismal level. So we have a primary hallmarks of aging, which are the fundament of everything that happens in our cells, and it is very much grounded by the error theory, because we have genomic instability in aging cells, we have telomere attrition, we all know this, and we have change in the proteostasis, and also change in the information theory, which is called epigenetic alterations here. We also have compensatory hallmarks, which are very important, 3 of them. They are a result of the primary ones, and then we have the integrative that go up to a higher level, upper level of the human organism, and also show a very big decline in aging organisms. So now we know all these 9 hallmarks. As a matter of fact, at the beginning of this year, a 10th hallmark has been promoted also, and this is the stiffness of extracellular matrix, which is a very important phenotype of aging cells, and not only, but it is also very important that people are working a lot in order to elucidate all the fine molecular mechanisms through which the aging happens at all levels that we have discussed, molecular, cellular, and organismal as well. And of course, all these interventions that happen now in the anti-aging industry and research is to tackle all these 9 or 10 hallmarks of aging by certain high-tech drugs and also approaches in order to prolong the health span of an organism. And a lot of clinical trials are underway now, and a lot of them are very much successful because they show some kind of an improvement of the biological age at a molecular level in the individuals that are under these clinical trials. So yes, can we hack the code for immortality? Well, maybe. We did not yet. We extended the lifespan. We succeeded to extend the health span to some extent, but we have a lot to do. And this should be done by the smart touch on big amount of health and molecular data that should be analyzed by sophisticated analytics, neural networks, and artificial intelligence in order with scientists to be able to promote, to translate to the patients, revolutionizing diagnostics, treatment, monitoring, and drug discovery in order to extend our health span. Because the vanity of living forever is something that I believe all my colleagues did not like that much, but what we really pursue is extended health span and also a very good biological age at the later stages of our chronological. And with this, I thank you for your attention, and I'll stay for the discussions after that. Thank you.
Thank you. It was a really interesting talk, and I thank you for making the distinction between lifespan and health span, because I feel that this is a topic that a lot of people don't quite understand. So thank you. I'm sure it's going to be an interesting discussion in the end. Okay, so we move on to our next presenter. This is Professor Sarper Diller, well known for his work in many